Hi, I'm Dr. Galati. Today, we'll be exploring the fascinating world of the bladder and its normal function. Understanding how the bladder works is essential in recognizing when things go off track, like in the case of overactive bladder. So let's dive in. The bladder is a remarkable organ within our urinary system. Its primary job is to store urine produced by the kidneys until it's time for elimination. But how does this intricate system work? It all starts in the kidneys, where blood is filtered and waste products along with excess water are converted into urine. This urine then travels down the ureters, two thin tubes that connect the kidneys to the bladder. As the bladder fills up, it stretches to accommodate increasing urine volume. Remarkably specialized nerves in the bladder wall send signals back to the brain, keeping it informed of the bladder's status. The communication between the bladder and the brain is a sophisticated process involving a delicate interplay of nerve impulses and chemical messengers called neurotransmitters. The brain processes this information and determines whether it's an appropriate time to empty the bladder or not. One of the most remarkable aspects of our bladder function is our conscious control over it. We can decide either to hold onto the urine until it's convenient for us to visit the restroom, or if we feel the urge to urinate, we can go to the restroom. When we're ready to empty our bladders, the brain sends a signal back, prompting the bladder muscles to contract. This coordinated contraction expels the urine through the urethra, the tube that carries urine out of the body. After emptying, the bladder relaxes and the process of filling starts up again, as the kidneys continue to produce urine. That's how a healthy bladder operates. But there are instances when this harmonious system becomes disrupted, leading to an overactive bladder. In an overactive bladder, the nerves controlling the bladder become overly sensitive and start sending inaccurate signals to the brain. This causes the brain to perceive the bladder as full even when it's not. As a result, individuals with overactive bladder experience frequent and sudden urges to urinate, often accompanied by a sense of urgency and discomfort. It can be quite disruptive to one's daily life and affect their overall well-being. The good news is that if you're dealing with overactive bladder symptoms, effective treatments are available. These may include medications, behavioral therapies, lifestyle changes, as well as some minimally invasive procedures. As a urologist, I encourage you to seek professional help if you suspect you have an overactive bladder. We can work together to create a personalized treatment plan that addresses your specific needs and helps you regain control of your bladder function. Thank you for joining me today to learn about the normal bladder function and the challenges faced in the cases of overactive bladder. Remember that taking care of your bladder health is vital for your overall well-being and quality of life. Take care of yourself, and until next time.